Welcome to my short presentation for HSR UK 2020 on joining up health and social care policy implications for evidence identification from a rapid review of safeguarding. My name is Anna Cantrell and I'm a research fellow at the School of Health and Related Research, University of Sheffield. I work there as an information specialist and reviewer. A substantive part of my work is for the Sheffield Health Services and Delivery Research, Sheffield Evidence Synthesis Centre. The Centre produces reviews for the National Institute for Health Research HS&DR programme. These reviews identify, evaluate and summarise available research evidence on topics and highlight the implications for NHS decision makers and priorities for further research. This presentation focuses on a recently conducted review of evidence on the recognition of risk in safeguarding children and young people. The work programme had previously focused on health topics, and this review reflects a wider policy imperative to cover interventions delivered within healthcare, social care, or combined health and social care settings. Studies that we included in the review involved diverse health, allied health, and social care professionals, doctors, GPs, consultants, nurses, social workers, to name a few. To ensure that we retrieve relevant research from health and social care, we thought carefully as a review team about the different databases we'd search to ensure that the ones we chose covered health and social care research. And this presentation describes our experience and the implications. The research questions that the safeguarding review aimed to address are provided on the slide. I started by conducting an initial Medline search, and this was then adapted to relevant health and social science databases. The wider remit of this research project required additional searches of databases to cover research involving social work, healthcare professionals and social care professionals. And the additional databases are provided on the slide. The search combined terms for child abuse or neglect with terms for safeguarding and child protection, early help and different health and social care professional roles. The search was combined with a review filter to provide review evidence and also a UK filter to limit research conducted in the UK, as this was most useful to our funder. The database searches for this review retrieved 9,990 unique references, and the review included 158 studies, which reflects the wider scope of the review. The included studies were categorised using an a priori coding system into strategies, policy and guidance, organisational / cultural studies, initiatives and reviews. The reviews were included to provide relevant international evidence. This expansion to cover social work and social care aspects did increase the number of results retrieved dramatically, which impacted on the time taken to screen the results, on the time for searching due to the larger number of databases, and this led to increased time on reference management. However, the social policy and practice and social care online databases cover grey literature sources, which meant that grey literature was retrieved during the database searches and that further grey literature searches were not needed for this review. The review team are still analysing the impact and implications of this wider joined-up remit. Many of these studies included in the review covered barriers to interagency cooperation and ways of overcoming these. It is very likely that future rapid reviews will span health and social care policy, making it important that we recalibrate our existing sources and strategies for evidence identification. In future reviews, we could analyse the implications of using a range of different databases, different search methods and terminology, time taken for the searches, for the screening, and also the potential yield of the different databases. Thank you very much for listening to this presentation. If you do have any further comments or questions, please do add them below the video and I will respond to them. And if you do want any further information, my email address is also provided. I do hope that you enjoy the rest of this virtual conference.